was the visiting scholar at Army Khan's unit, so it is quite delighted for me to join with Hong Kong U Law School again. This year marks the 20th anniversary that China stopped labeling homosexuality as a disorder. So it is the very time to talk about why China is still labeling homosexuality people as kind of the ill people, and what is the future solution, and what is the way forward. Now I'd like to share my screen and to give you the brief introduction on the state quo, and then um, I pass the floor to the rest of the experts to share with us. So without further ado, I'd like to start. In After 20 years, what is the situation now? I'd like to start with a case that is the homosexuality conversion case. In 2016-2017, in Zhumadian, a person involved in the case named Yu Hu. At that time, he was in a heterosexual marriage. He was about to divorce with his wife. One day before the time planned for divorce, he was being sent to the hospital to be treated for 19 days. During that 19 days, he was forced to take pills or other medicines, and he was confined, deprived from freedom. If he don't take the medicine, he has to be forced using the violence to force him to take the medicines, and he was verbally bullied. After 19 days of treatment, because of his boyfriend's appeals, and one of his friends called the police at the local place and released him out from the hospital. Just 1 week after this incident, he was run out with his boyfriends. And when I was meeting him 1 month later after this incident, he was not brave to recall anything that happened during that time remaining at the hospital. And every night he was suffered by the nightmares. So after 6 months, we started to ask him what happened inside the hospital. So in 2017, we helped him to file a lawsuit to that hospital. Finally, he withdrew that lawsuit. This is a very typical case, especially for those homosexual people and the people belonging to the generation of 1980s. Even they have the awareness to be themselves, they are still under great pressure, and they cannot be themselves, and they were being forced to receive the treatment or the therapy. China had been labeling homosexual people as disorder. There are a lot of the systematic reasons and the public awareness reasons in the regulatory aspects why we think this year is the 20th anniversary, because in CCMD 3 in 2001, China started to decriminalize and calling the homosexual or bisexual people as disorder or mental illnesses. In psychological consulting and the psychiatric sector, they don't release any guidelines to regulate this kind of the practice related to homosexuality. The textbook used in the university and the training material for consultants, psychological consultants, they are still calling homosexual people as a kind of the disorder. So there are the factors beyond the family and the society. There are some systematic factors behind. Starting from 2014, we started to use the means of the law to fight against the fight for the rights of the homosexual people. That's why we had the first the case lawsuit of the homosexuality conversion, I was put to a clinic. That clinic was advertising themselves as being able to cure homosexual people. In the verdict from the court, finally we got the wording that homosexuality is not a, a kind of the ill. So we are using various means of the law to change this topic and to change the context of this situation. In 2014, in 2016, we had a lot of the assistance program implemented to help those homosexual people. During this process, a lot of the young people became quite vocal. Some of them involved in the case, some of them were not satisfactory with the description in the textbook on homosexual. By 2019, according to my incomplete statistics, in this map, there are 116 clinics or medical service providers and hospitals are providing the conversion therapies. They are located mainly in the eastern area or the big cities of China. Some smaller scale cities and the western area not being covered, so we are not sure whether they have this kind of the organization. Transgender group is now being the subject of the conversion therapy. In this Weibo, we found this 18 years old girl was being put to the conversion therapy, and so a volunteer came to help her. Another volunteer on site came to her to help her in Jingdezhen area, and that volunteer uh, came to the site and helped that girl to go out of this hospital. As the textbook aspects, the latest news is that the G9 University Press House Pressing House uh, against that, but the people does not win the case. So in the next 20 years, what is the way forward? And we have some law and rules. Can we further improve them? Do we have a psychiatric standards on the homosexual people? The psychological consultation sector, are they going to put the specific guidelines and in the sexual homosexuality in the society? Is that possible to bring out more cooperation with more stakeholders? So later on, I'd like to touch upon the last point. We have a lot of work has to be done, and I want to advocate our program. If some people around you needs the help or suffering from the conversion therapy, you can refer our help to those people. Sorry, technical issue. Uh, the interpreter cannot hear from the speaker because of the signal.
我刚刚是不是断了？刚好我讲完了。
Okay. Though I was offline just now, but I just finished my presentation. Now I pass the floor to the chairman of Fujun from the Guangdong Mental Health Association to talk with us the mental health diagnosis standards and the process. What is the sector attitudes towards the homosexuality? Now I pass the floor to Dr. Zhao. Thanks very much. Thanks very much for inviting me to join in this seminar themed on the homosexuality being stopped court as a kind of disorder. I have been knowing Yang for many years. A couple of years ago, we started to talk about this shared topic with me. I feel the commitment of Yanzi, and Yanzi was quite professional in committing to this work. So we have our shared language, and we have the empathy, and we have the shared committee to promote this idea to improve the acceptance of homosexuality among the society. So upon the invitation of Yanzi, I joined in today's talk. I'd like to address this issue from a couple of perspectives. It's my humble opinions just for sharing and for your suggestions. First, the psychiatric diagnosis and the categorizing. We have two kinds of the disorders, the physical and the psycho ones. The psycho disorders is quite different with the physical illnesses because Homo sapiens or our mental movement, what is the foundation of that? We have little known of that. Because of that, the psycho illnesses has been known for by humans quite differently with the physical illnesses because the physical illnesses can be measured by those bio parameters or the physical parameters like you have the high pressure. If your pressure measures go beyond 150 or your low temperature go beyond 85 or 90, it's quite static. And the ammonia, if you at per ml of your blood, if you have a certain amount of the component in your blood, we can call you ammonia. And the malfunction the same if the newborn people is under certain weight is malnutrition. So it's quite static when we are diagnosing the um, the high pressure or other chronic diseases, we have the quite constant measures, physical measures. When different people come to decide and diagnose those illnesses, it's quite stable. It won't change much. But for the psychological illnesses, varied a lot. The symptoms, the mental symptoms, varied to a larger degree. It cannot be measured subjectively. They can only be measured objectively. So what should I mean? But when I say it's less subjective, it doesn't mean objective completely. There should be some hidden patterns. We are using the patterns and the principles of the psychology. We set some parameters in deciding the psycho illnesses. So we cannot bluntly say the psycho illnesses is kind of objective, but I can only say because of the less subjective nature of the psycho illnesses, we cannot measure this kind of the illness precisely. So the mental disorder, when it comes to diagnosis, it has a degree of the subjectiveness. Why it has a degree of being objectiveness is related to our society. Compared with the physical illnesses, it's not driven by the bios factors only. It may be driven by social and factors. For example, for a phenomenon, people may consider a same phenomenon normal or abnormal. So why you think it is normal? Is that by majority's view? Like per male, you have 3.25 million blood cells. I simply say you're ammonia or you have the bacteria. The blood sugar is over a certain amount, so can I simply say you have diabetes? So I think each patient can show some level of variation. You can only by statistics to say to a large amount people is falling to this category and we call it normal. So normal and abnormal We don't have a red line in between. We cannot say that because this phenomenon happened in most of the cases, it is just abnormal. So this is one features I want to talk about the mental illnesses. Second, about China's standard that it has been mentioned by the chairman. China initiated the CMCC3 in 2001. That standard had been tested in China at that time in 1980s. I started to work as a medical service provider as a medical staff in 1987. I participated in the testing of CMCC3 and when I was doing at my doctoral study, my supervisor was the composer of the CMCC3. So because of that, I'm quite familiar with CMCC3. Chinese compiling of this standard draws a greater amount of references from the international peers, like SED 10 and SED 11. In those references, they uh, assert a great amount of influences to Chinese practices. International categorization um, of the mental illnesses had been influenced significantly by American people as AD11 that is to be implemented globally. It is the ESM5, it deprived from ESM5 from America. So that paper has a great importance to this world. So in that paper, it said the homosexuality, the sexual orientation, and the sexual minorities. Because of that paper, we stopped calling those people as we ruled out those terms. So that laid a very good landmark to our world. So China followed the international guidelines in categorizing the homosexuality-related diseases. So CMCC3 played a big role in this regard in the mainland China. Homosexual assault had been benefited a lot from that paper. The third point, sexual orientation awareness is related to the society development at different stage of the society because of the different regulation, different economic patterns and marketing and the social situation and the degree of economic development. The sexual orientation can be perceived differently. Culture is diverse. Sex is a part of the culture. Sexual orientation is also a part of culture. If the society is lack of culture diversity, has low acceptance of different sexual orientations, and has different values. In China, we respect the value of family that enjoys the great importance in the development of the society and the personal psychology. Parents' value to world and sex also influencing this kind of the perception. When people come to different sexual orientation, whether they will disclose it or they will cover it, is related to the society. If the society is acceptable to this minority, that person may disclose it because it's not shameful at all. If the acceptance is low, naturally that person may not disclose it, but consequentially may be harmful to the person's psychological development. The fourth point I want to make is that what we should do. The first is uh, to popularize the scientific knowledge on the homosexuality, transgender issues, and the bisexual relations. We have to spread those knowledges in the communication aspects. We have to build an inclusive atmosphere. In specific, besides from the publicizing, we have to face those issues directly. We cannot hide ourselves from those diseases. China just finished the census of the seventh times. We have the positive and negative aspects from those census. China undeniably has the aging issue as a developing country, but we suffer from the aging population that would insert very negative impacts to the development of this country. How to solve this issue? China doesn't get rich yet, but China is aged. So how to solve it? We released the family planning policy, one-child policy, and promote the baby raising. In this regard, what should we do to our sexual orientation and homosexuality relations? People may not be easily accepted because it's out of the mainstream thought. So it's quite confrontational with the mainstream views. We have to face this issue. The right of those minority people have to be solved directly. How to strike a balance between the minority people with the mainstream? This is the problem. How to fit them in the society, how to include them in the society and build an inclusive society. This is what we should do. This is the principle of the communist China, like the parity and fairness. So this is the quite important aspects from the population development to the sexual orientation. We might think there are some confrontational aspects, but we cannot avoid it from those things. We have to talk them openly. We have to face them directly. In this way, we can safeguard the rights of those minority people. So this is what we want to do. First, we need to face the hardship and solve the problem. Therefore, we are able to serve the best to the minority people and build a good society to the minority. So, as the interest of the time, I'd like to draw an end to my sharing.
我们在3、4年
Thanks
前，
very much,
在
Dr.
耶鲁
Zhao.
大学有位叫
Three
做
to
林的
four
医
years
生，
ago,
当时来国内做分享，
a
那时候就去了到
professor
那
from
边，
Yale
是
University,
对广东
we
省的一些
visited
精神医学的医
Dr.
师
Zhao
做了很多的推荐。
because of
那他
his
特别强调的就是
familiarity and
发
his
现疾病常
experience
见
in
是
the
人的社
mental
会性状况，
disease training and
在
mental
结束
disease
你的论文之
situation.
前，也追问了
So
一个
before we
蛮
close the
有趣的问
floor
题，
of
就是在
close
当地
your
大学
floor,
在
I'd
中
like
国
to
的
mention
我
that
们
you
的
just
教育体系
mentioned
很有保障，
in
精神医学行业很多都是
China,
用
the
美国
mental
的
health
标准
sector
DSM-15，或者
is
有一些地方是
employing
用这个标准
ESM3
ICD-10。
or
那
WHO
我们的卫
standards,
生部门也跟我
and
们
the
说，有出
China's
现这样的
relevant
情况的时候，
authority
先告诉
were
你。当然，我
distributing
相
those
信这
standards
个
and expecting
很
them
多
to
在实务领域
implement
从业
those
的时候，
standards
很多的
in
医生，
practice.
包括心理咨询
But
师，
in the
也
real
很知道这
practice,
个
some
在
doctors and
适当病症
psychological consultants
假
doesn't
如认知边
practice
缘的医
those
生的
standards.
学
They
的
still
这些经
regard
费，或者
the
我们的这个
homosexual
行业
people
协会
as
有没有可能
illness,
做出一些
as
更
ill
进一步的
people.
改变，
So what's
或
the
者是说方
association
式
could
怎么
do
样，让
to
这个病
promote
人
the
更好的
change
理解。
and what else you can do
你这个问题
to
很好啊，
force the
我想呢，
alteration
目
of
前
the
的这个情
behavior?
况是存在的啊。首先我
I
认为这
admit
个任何疾
the
病啊，这种
situation
现象是
you
存在，而且呢
mentioned
是普遍存在的。
are quite factual
为什
and
么？
quite
因为呢，这
universal.
个作为一个精神科的医生啊，还
As
有这
a
个这个专业，
psychiatrist,
实际上
they
从
have
各
the
项的精神上
responsibility
都
of
存在实际上的
diagnosis.
局限。
Those
也
psychiatrists
就是
is
说，他对
facing
整
a
个社会的
certain
整
group
个
of
这个
mental
精神
disordered
状况呢不
people,
一定了解
so they
啊。
don't have
所以说
a
呢，他长期
full
处在这
picture
个
of
疾病
the
中，所以说
society.
看
or the real situation. So they probably regard every people come to them as something abnormal or something disordered. So we have to change this kind of the perception. We have to raise their awareness on the sexual minority. Psychiatrists are the frontline people. If they play their role right, they can double the efficacy. As a psychiatrist, they are the professionals. They have the responsibility to contribute to the development of the society in this regard. So we have to raise their awareness. Though they are professional, we have to let them know this specialized knowledge, including the psychiatric doctors and the nurses. We need to offer more knowledge to them. I hope later on in your stage, in your platform, or in other association, more professionals can join in and interact with us. And through the learning, through the education, I think we come to the realization that we have the shortage of the sexual orientation education. Just now, someone raised the question on transgender issue, like ICB-3, ICB-10 defines homosexual as not disorder, but how about transgender? So we invite a person involved in this respect from the Beijing Homosexual Center to talk about the transgender issue and how to stop people labeling transgender as a kind of the ill. I'm He Tao, transgender director from Beijing Homosexual Center, and I'm also the initiator of the transgender hotline. I'd like to talk about the forced um, transgender conversion therapy. So I just talk about the recent development or the latest. I know before this, a lot had happened. I just listened to the presentation of Dr. Zhao. I was quite touched. I saw all the progresses and advances we realized cannot be made possible without the efforts like Mr. Zhao's. The first is coming from a snapshot. It's coming from a case he shared in this sort in the WeChat moments. He was saying that he wants to sleep as forever and he wants to be a normal girl. We know that conversion therapy, what it is. Conversion therapy, there we don't find out a precise definition. So according to my field study, I come up with my definition about conversion therapy. We think conversion therapy in the name of a medical service and against the personal view using inhuman methods to forcefully change the sexual orientation, like electric therapy, controlling, submersive, threatening, beating, stuff like that. Ke Chen was the case I mentioned before. Excuse me. I'd like to skip this. Last year, starting from the second half of last year, we joined in the case. The person involved in named Ke Chen. Before he came out of the closet, he was quite remarkable. He was the #1 prize winner of the Asian robotic championship. After coming out of the closet, the parents cannot accept this, and he was out of the context with our network. He was sent to a school specializing in the prohibition of of cyber addiction. We were trying to call the police to join in, and we said that that guy was being kidnapped, and the police contact with the parents, and the parents denied that guy was being kidnapped. And the police called to the school, and the school said there is no one in our school. And so the police come back to us. You see, the parents has no complaint, and the school thinks there is no these students in that school. Before calling to the police, we were trying to talk with the parents of that case, so they were quite stubborn, and they closed all the door of communication, and they blocked us in the communication channels. So why I want to talk with you on this case, because this case had been publicized over the media. A lot of the platform can find this case. So in Fengmian News in 2020, December 15, it covered this story. And this second case is related to my first WeChat moment. This case is similar with my previous case. 19 years old, they had been perceived as an adult by Chinese law. They can work and behave independently. This case has been assaulted by parents, had been bandaged by parents and sent to somewhere um, to inject some medicines. So they even find the help from the deist, and this case had been sent to the mental health hospital, and that hospital thought this kind of sexual orientation cannot be treated, cannot be hospitalized. So in the end, that hospital rejected the admission. So when we called to the police thought it's the eternal affair of that family, and the police said the parents are parents, and the volunteers are not the family members of those of that guy. So the police tend to believe the parents rather than believing our volunteers. So the police didn't help us to help that guy, and even influencing the kids negatively. And the mom in that case doesn't believe it is a fact that it's a matter of the sexual orientation, and the mom was trying to find an excuse to see that this guy has the tendency to harm himself. If you're familiar with law, you know that because of if you are really like the guy has the tendency to harm yourself, and the parents has the liberty to to regulate your behavior. Later on, he developed PTSD when he was in front of the mom, and he was having very severe symptoms when the mom called him. But the mom doesn't realize that this kind of the practice or behavior is quite irremediable, and this kind of the damage of relation cause the irreversible damage to the parents' relation with the children. So in the case of Kao Yu, we had a lot of media coverage. You can find it from iPhone.com and Beijing Youth newspapers and China Pediatric China Charity Association. Those two cases I can talk like you with you in this open way, but every month I can receive a lot of similar cases, but I have to practice the confidentiality. So if you want to know more cases, more details on those cases, you can search, but I can share with you some features of those cases. The age was quite low. They were just 18 or 19 years old. At that time, they were thought they had the freedom to be themselves because they were 18 already, but they don't realize that the patriarchy is quite powerful. The power of parents is over the power of law in some cases. The volunteer, even we involved in the case, we cannot help a lot. We cannot prove our connections with those cases. The social system or the relevant social workers are not in place. We don't have the consultants, and the police people are not trained to be aware of this kind of the situation. I'm not trying to criticize or being picky. I have to say there is something not in place. So conversion is still the mainstream. Conversion is still quite popular. People were being thrown to the conversion therapy service provider, whatever the venue, like the temple or in the Chinese traditional medicine clinics. So there are a lot of the places that were offering those therapy. Statistically, we are doing 2020 transgender survey in China. In that, we cover the conversion therapy. 112 respondents had suffered this therapy, and the average age range was quite low. Among the 112, 90 of them were thrown to that therapy by parents or by their independents. The major way of therapy is the verbal abusing and the forceful way of changing their dressing and taking the mental health illnesses. There are also some other ways like electricizing, beating, and forced rape and depriving freedom. And they are also practicing other ways to try to cure them. In 2017, we did a China transgender people living situation survey. We found the suppression and anxiety has a high popularity among transgender people. The mental health condition of the transgender people was quite high. The suicide rate of transgender people was high, 4 times higher than the rest of the population. There is a thesis, there is a paper talking mental health and resilience in transgender individuals. What is the type? What type of support is most effective? Family support has been proved to be stronger as a predator of anxiety and depression. So we found a a shortage or a weakness in China. First, we don't have a very good mental health system in China, and the family support for transgender people are not in place. In most of the cases, it's that the family people who send those sexual minority to receive this conversion therapy. So it's worse. At the third level, some professors, the expert people's representative, published in the Chinese feminist study uh, journal mentioning the issue of conversion therapy and appeals to ban this therapy. She thought she is against the constitution and against the human rights. Thanks to Ms. Liu Minghui, by 2019 May, WHO published the 11th version of the international disease category. Transgender is no longer a kind of the disorder. In this situation, all kinds of the conversion therapy are groundless. They don't have the scientific base of the syrup for the therapy. And China Health Commission had also published the regulation and the notice to promote ICD-11. We thought it's really the quite enabling situation. People's representative became quite vocal in this issue. WHO banned this kind of the practice, and the Chinese authority started to adopt this kind of the documents from WHO. But we have some problems still. We don't know why. What is the reason behind this ICW-11 documents is now not available in the website of this authority, but as a replacement, this authority published a mental health diagnosis guidelines. This guideline is quite in line with ICD-11, and some parts had been revised in the sexual identity. We still have the homosexuality or the similar wordings like and this can like homosexuality is still being considered as the split of the sexual split of the mental disorder. I realized all the rest kinds of the mental disease are in line with the description of the ICD-11, but only homosexuality were not being adopted. The homosexuality, there are some conflicting description, like the common symptoms is depression. But there is the conflicting points is that homosexuality had also been described that homosexuality cannot be used as a kind of a symptom to diagnose other mental illnesses. So again, I'm not in the position to criticize someone. I just share what I find out from the reading and the researching. Later on, I want to communicate more with Chinese authorities and apply um, for the transparency of the information and ask for why they still don't uh, implement to stop calling transgender as a kind of the disorder. What's the reason behind? I will continue our 2021 China Transgender Health Survey and to complete the information database because China, we don't have a master data in this regard. We will find for more media coverage like the previous two cases we mentioned that received a good amount of attention from the public and raised awareness on the potential harms on the conversion therapy. We want to work with more psychological consultants and some homosexuality-friendly directors, doctors. Let those people know that the whole transgender people is not ill. They just need a better social environment. So this is my today's presentation. I'm I apologize. I overrun a bit, but last but not at least, I want to join with everybody to go through this challenging period. Thanks very much for He Tao. I thought it's very insightful sharing, though we know we have a lot of the efforts from the professional field. Like you mentioned, the Chinese Health Commissions published some documents expecting all the medical system could adopt ICD-10 or ICD-11, but in practice, a lot of the problems happened. Many people or other associations can receive the appeals or for assistance on daily basis. So later on, I think He Tao and the doctor and lawyer Zhao could share with us more on those cases or more cases. So lawyer Zhao is about to share with us his assistance to those cases. I saw before that, I want to say we have very heated discussion in the chatting box, and I respect the difference of the views and ideas. So if you have different ideas, feel free to share in the chatting box. Our staff would collect some of your questions to bring them to the Q&A session. Just now, Walnut He Tao mentioned the cases and the assistance they offered for the suffering people of the conversion people, for the conversion therapy. But, every year we are able to we received some conversion therapy people, and once we received those requests for help, we pass it to lawyer Zhao. Lawyer Zhao would like to give us the legal basis of those assistance. So, Amika, I pass the floor to you to share the screen on behalf of lawyer Zhao. Amika, later, I request you to share the slides. I think lawyer Zhao is can kick off now. And dear friends, I'm Zhao Hu. I'm a lawyer. I'm gay. And thanks very much for joining us. I'd like to share with you the related legal questions. Yanzi, you just mentioned some cases. In 2014, the court decriminalized homosexuality. In Yuhu's case, lawyers reported to the local health authorities. The local health authorities, according to that verdict, because that verdict stated that homosexuality is not an illness. Last year in Guangzhou, a civil organization was publicizing their cure to homosexual people, and we recorded those public advertisements. So we report this case to the Guangzhou local authorities. Last month, we received a new case. I'd like to ask Amika's help to turn the page. What's the case? In 2014, Jens received a request for favor at the southern city of China. We call this this guy as Z. Z came out of the closet, and because of that, he was being sent to the mental health hospital. In 24th of March, we create a WeChat group, and some volunteers joined in the campaign. On the same day at 5 p.m., we talked 30 minutes on WeChat with Z. At that night, around 11 p.m., we invited a local volunteer to join in the WeChat group. This day after, in the afternoon, I added the WeChat of that person involved in the case because I need to have some of his information like ID. And after the discussion, the lawyer drafted an authorization letter. It says they authorize L to report on behalf of him on that hospital receive patients in the name of homosexuality. In the 26th, L signs the letter of authorization electronically. L then takes the letter, went to the police station and report. they got the reply from the police that it's related. We have to listen to the doctor, so they cannot they cannot go to the police. So then L went to the hospital, and the doctor know, oh, you went to the police, so we don't reply that. So later on, in April 11th, that person involved in the case was being released. So it's been 2 weeks from the beginning of our WeChat group to the release of that person. This is the timeline. I'd like to analyze this case from different aspects. The basics of this case. The basic of this case, this person was born in 1997. Now he is 27, 23. He's gay, graduated from university, don't have a job at that moment, but came out of the closet. He published some articles at Douban and published some audios online. Because of being an open gay, the relation with the parents tends to be tension. From the 15th of February of 2021, he was being treated as having the characteristic barriers or obstacles or human characteristic barriers is the kind of the mental illnesses. As I'm a lawyer, I'm not an expert in the medical categorizing. So I just have those ideas whether we can categorize it as a mental illnesses. I consulted with some lawyer with medical background. Characteristic barriers can be regarded as a kind of mental illnesses, but it's not the illness that has to be forcefully treated. If you have this kind of the disease, you can only be treated voluntarily, and you have to be assessed by evaluation form, and only you reach to certain severe level, you can be hospitalized. Those level means you have the harm to be self-destruction, or you have behaved in a harmful way, either to yourself or to others. But in the case of this guy is quite nice. He doesn't have any behavior that harmful to himself or to the rest. So because of according to this categorization, he cannot be forcefully sent to the hospital and receive the treatment. So in the name of homosexuality or in the name of the characteristic splitting, the hospital cannot forcefully receive this patient. So when we confirm the basics of this case, we started to figure out the legal means to help this guy. At local levels, they have 1, 2, 3, 4, 5 hotlines. In Hebei province, that hotline just record your reporting and reply you within 1 week. The second way in our mind was to call 110, the policeman. The third was to talk with the hospital and the doctor. The fourth was to authorize volunteers to report to the police. If we sort to the 110, we have to describe the situation quite precisely. If we go to the hospital and talk with the doctors, we have to go through a lot of back and forth, and we have to be quite eloquent. And if we go to the police station, we have to be very capable in communicating with the police station, with the police people. So in the end, we use all the three means I mentioned. First, volunteer L consulted with the lawyer and reported to the police. He recorded the phone call with the policeman. Meanwhile, the volunteer reported again to the police station at the area of the hospital, and he recorded again. The guy Z authorized the volunteer L and signed it electronically, and we offered the ID copies, and so we offered the volunteer's ID and the examination results from the hospital. The guy Z had the very long recording with the nurse and the director and the doctors, and we saved those recordings into a disk and report submitted to the police. At that time, the volunteer invited two of his friends to go to the police. When the volunteer was talking with the police at the police station, one of his friends was recording the whole process. That guy was a straight. So that offers a different perspective as a straight man who joined in the case. The response from the police is that first we had to listen to the doctor because the police was clueless on the splitting of characteristics. Our volunteer at that time was not conflicting with the police. We were just trying to commute. After reporting to the police, we consulted with the relevant people again, and we set the strategy to ask the volunteer to go to the hospital, talk with the director again. At the second day of April, volunteer find the doctor in charge of Guy Z. Why we are able to find it? Because in the examination results, we can find the name of the doctor in charge. And the doctor said, "You have reported to the police, so I cannot reply you in any material way." So in the rest of the time, we were thinking to figure out a way to adopt different means to communicate with the hospital. So we were thinking, we were strategizing, but we were delighted eventually that Guy Z let us know that he was released from the police eventually. In a hint that this latest case was quite cheerful. Why? First, that case, the Guy Z was quite cooperative, and the Guy Z was well cultured and educated and able to communicate precisely. After communication and in the process of communication, we accumulated some evidence so that serves as a base of our legal judgments. Our volunteer was also very capable. At the beginning, Yanzi and me invited two volunteers. One volunteer were not such available to work for that case, but this volunteer was fitting for this case because of his age, because of his availability, and because of his network. Because you see, he invited one street guy to go to the police station with him. That eventually been proved as an effective way. And we invited other associations like Tongyu and the Beijing Homosexual People Centre and the Dai Lawyer Network. So I'm quite grateful to lawyer Liu Wei from Chenzhihua Law Firm. Liu Wei was representing Chen Zhihua in 2014, and he keeps suggesting us when we're dealing with this case. My conclusion is that lawyer doesn't know much about the medical things like the splitting of characteristics. For me, after some suggestions and I consult with the professional professional books, I realized the difference of being treated and the fact of having mental illnesses. The second is the terms, is the acknowledgement letter of hospitalization. That has been suggested by Liu Wei. That Z doesn't sign for the acknowledgement of hospitalization. If Z had signed that letter, it would insert more uncertainty to this case because they can regard Z as voluntarily joined in. We have the recording, video, and audio. The police was quite nice, but the police didn't know much on the difference of homosexuality, depression, anxieties. They don't know the difference in between. The police doesn't know whether it is reasonable to forcefully restrict the homosexual people. They don't know whether this kind of the behavior infringe the freedom of the people and infringe the relevant ordinance. So I think the police doesn't have a very clear idea on those questions. Now we have some thoughts. Further thoughts is that whether we should report to the local authorities on the misconduct of this hospital. That means without the agreement, they forced Mr. Z to hospitalize that gentleman for over 40 days. At that time, Mr. Z, whether he is willing to file a lawsuit, a civil lawsuit to the hospital. This is my sharing. Thanks for our chairman. Lawyer Zhao shared with us a very specific case. I think what I want to mention is that every case is unique. In this case, I think Mr. Z was quite lucky. So we had to have a lot of the right resources, like the gentleman Z was able to express his ideas. In the recent months, we had some very sad cases that transgender people was sent to the conversion therapy center. Because of that, some volunteers teamed up to share their assistance and collective efforts to those cases. So I want to pass the floor to He Tao and respond us or share with us some difficulties that you went through when you are trying to help those people, and especially when the hospital was trying to label the transgender people as having other mental health illnesses, and when you come to the police and the police doesn't respond to you quite positively. So could you share with us some relevant cases? Thanks very much for sharing.
一般其实我们遇到的最大的一个问题，
I think the
就有的时候，就像这个赵律师其实有分享
primary
那个当事人
issue we went through
说非常好的
is that
非常配合，能够
whether the party involved was quite active and was able to
遇到的很多跨性别的案例当中呢，
was able to cooperate with us. In some cases, we helped that the transgender people was sent to the mental health hospital. They were being evaluated at the initial stage. Luckily, at that stage, they can connect with us. If they were sent to the conversion center, they were disconnected. So if it is the later case, it should be the parties, relatives, or friends reported to us. So we were disconnected with the party inside of the conversion center, so we don't know what kind of the assistance and what kind of the request from those parties. The second difficulty is that most of those transgender people were quite young. They had to live together with the family. They still have the learning journey. They have to finish their academic journey. So in that case, if we report to the police or we sort to the very forceful means to help the party, that might not be the most effective or beneficial way to those parties. So in the first place, we were trying to contacting with parents, hospital, and schools. If we can't find out a way to help, we may eventually go to the police. If the police cannot help, we might use the reply from the police and we might call 12315. I thought in one case we helped to call 12315 and we called that hotline a couple of times and we consumed all the patients of that hotline people. Then they set up a three-side meeting, trilateral meeting. So that built up a communication channel. So in the meantime, we were being supported by the local center for homosexual activists. So the common hardship is that we cannot connect well with those parties. Second question is I mentioned is that calling to the police station may not be the favorable solution. Number three, some of the cases may be released through WeChat, and some requests for help may be released through WeChat or QQ or social media. Because of this releasing or the spreading of the information, some people were trying to help but not trained professionally, so we cannot form a collective efforts and we don't know, we are not coordinating well with each other, and eventually we were trying to intervene with each other, like we don't plan to call the police but someone else called to the police a couple of times. So we think we have many difficulties, so we want to set up a network of volunteers and train those volunteers unanimously. So in the future, we can form a quite a collective effort. I think it's quite important to do what you said, and we saw from the recent assistance programs, I think all the volunteers were quite active and proactive even to help those people. But in the cases like you mentioned, they cannot, if they are disconnected, the volunteers cannot talk and connect with them, so that may hinder the efficiency. Last is always the best, and we have a very privileged speaker to talk about how to do the psychological consultation or how to do the mental health well-being development. And we are quite delighted to invite Dr. He Ying from Xiangya Hospital. So how do they implement the confirmative consultation methods in the clinical study, and what is the effect of this kind of the therapy? And we hope to implement these sound practices into more consulting patients. Now I pass the floor to He Ying.
首先，我自我介绍一下，我叫贺莹，我是来自中南大学。
I'm He Ying from Zhongnan University. I'm a psychiatrist. So I think Dr. Zhao is absent, so I may take the liberty to answer some of the questions. I think in our diagnosis guidelines, we mentioned about the auxiliary suppression. Auxiliary suppression is a symptom of heterosexual disease. If you have the symptom, it's induced by someone else. It's different. In some cases, some patients may have imaginative hearing or imaginative viewing, that they were imagining that someone will cut their vagina, and we think it is not her own mentality, it is someone else's mentality. So in our academic field, we thought it's not a volunteer mentality. So this is my response to the previous question. So I'd like to start my presentation now. First, I'm representing our team under the leadership of Li Xinghong from Xiangya Hospital to share with us our experiments on confirmative consultation. One is CBO, or we call it the Rainbow Club in Changsha. And second, personally, I'm a psychiatrist, confirmative consultant, psychological consultant. During 2016 to 2018, I had an intern, clinical intern in UCSD, and I was joining the campaign to revise the textbooks. I was joined in the liaison efforts to some professors, but later on we don't receive much responses. Li Xianhong's response team was doing the HIV prevention. HIV was was getting quite popular. 70% of the new infection was among MSM group. The HIV spreading was quite dangerous among those group. In the past 20 years, Dr. Li found a bottleneck of intervene, whether you provide the free condom or just educate to have the same sex, or just let them know the dangers of HIV. So they have been promoting this for many years. They thought there are a lot of free condom, but the MSM is getting more infection. It's getting more infection of this. So white people is just regardless of their health, what is the motivation behind? So I think there is the sexual minority stress. Sexual minority stress is a kind of the stress in every minority disease group, that is the discrimination, exclusion, or the kind of the discrimination. When we're trying to intervene the HIV people, because of those stresses, they have some problems of the psychology wellnesses, so they were prone to the very extreme behavior. So this is the new intervene perspective. Internationally, we have some effective intervene scheme that has been proved that through the confirmative consultation CBT, confirmed the consulting program and the CBT to reduce their high-risky sexual conducts. And in Yale University, they developed the esteem intervention scheme to reduce the stress and anxiety and eventually to reduce the risky sexual behavior. At our perspective, we introduced the esteem and to intervene the MSM group and to help their to help their well-beings, and we connect this esteem program with the confirmative consultation. We have the 10 interviews and we have 10 we might figure out the reasons of this kind of the emotion and how this emotion was driving to the reaction, and what is the consequential reaction from this reaction from the CBD perspective. We help you to find a way to release their anxiety and to safeguard the well-being of yourself. In America, it has been proved this is a very effective way to prove and to reduce the high-risky sexual behavior. So we were doing some intercultural adjustment of this program, and we had 10 seminars and interviews, and we introduced some culture background of China to fit the characteristics of the Chinese context. This is the training picture when we were abroad. Next page is showing you how we were conducting this kind of the training in China. Lasted for 4 months. We had 4 consultants and some NGOs and some research students and psychiatrists joined in the training. Esteem has been translated by the pronunciation as 一思堂. That is to promote MSM people to think positively and to improve their well-being. So it's like a lecture, and our slogan is to be yourself. You have to brief yourself, brief enough to be yourself. This is the result. The methodology, I want to skip it because thinking about the methodology may be too technical for students of the law school, but we skip it and we come to the conclusion part. Some as people were having some low level of anxiety and they are HIV negative. So we talk with them and through interviews, and we figure out the domains And we can group those domains into 4 categories. The first is the perception of SMS and the non-supportive social environment, and the acquisition strategy, and the stress for the mental and physical stresses. Family culture is a Chinese characteristics. Later on, we will show the influence of the family culture. Family culture and the marriage formality was quite popular in China. Covered marriage was quite common in China, also because of the family culture, and the domestic people was quite resistant to CBT. So when we come to build the connection with the consultant people, we have to make more efforts. The adjustment we made is related to the content, related to the form. We deleted part of the content that's not related to Chinese people. And so, because originally we have the assertive bill of rights, because we don't have this part in China, so we cannot let our respondent and interviewee know that you have the legal power to empower you to be yourself. But we added some Chinese culture features, we help them to build the better connections, and we did the role play to help them to speak out. The form changes. I want to speed up, so we build up the glossary to help them to describe what is the emotion. Like somebody doesn't know how to describe love, so I give them a list of glossary. So we give the online talks and to change the roles of each people. Later, we had the understanding, we have the way to improve the understanding, and we have some audio help them to some audio material to help them to understand the content. The pre-test results. Eventually, we included 8 people. After each talks, we will have an immediate evaluation, and an evaluation in intervals of 3 and 6 months. This is the immediate evaluation score downward trend. You can see from the beginning to the talk to the end, the stress and the anxiety level were going down simultaneously. In the 5th talk, the anxiety, the stress was going up a bit. It was probably being influenced by the confidence, and through the talks, it's the kind of the exploration of your core belief. Those beliefs might not be discovered in daily life. That might be quite cool. So when you are trying to know yourself, it could not be such such pleasing. So you may come to some suffering, but eventually it's helping you to release the suffering. So and so after the talk, we almost don't have the risky sexual behavior. So this is the parameters after intervals of 1 year. So anxiety and the sex without condom, both those 2 indicators declined. After 3 months of intervals, all the parameters were going down. So the internalized homophobia, so doesn't change much. So the internalized thing could be quite static. It cannot be changed much. So if they are internally homophobia, it cannot be changed much. So this is the result. The first, it is feasible, accepted, and this paper has been published in Psychotherapy. I really want to speed up. I have to. In domestic China, we don't have the MSM intervene study, and the psychological demands is quite high, and giving they are quite prone to HIV. So I believe the esteem scheme has the very good potential to apply for the SMM group and can efficiently reduce the HIV spreading. So the pre-test has some faults. The sample size is quite low. Some samples were dropped during the process. So later on, we will apply it to a more conservative, less developed area. They are more conservative than Hunan area. Now, what we are doing now is to put esteem into a network. We are doing an esteem promotion program. The advantage is that we can include more people to the esteem program, and our consultants can monitor and can serve as the kind of the teaching assistant, so as to sizable our program. So now we are doing the setting up and the experimental and adjustment. At the initial stage, beginning from the last year, we were preparing for this kind of the program, like the materials, the ethical declarations. And here is one picture even showing I was gathering with Yanzi. This is my personal feelings at the last my personal thought to this presentation, because of today's topic. And this is actually a word file, so the size of the characters might be small. I want to give you an idea, how do we perceive a homosexual, and how do we ban homosexual from being mental disorder? DS in 1992, WHO in 1992 deleted homosexual. Even you can find from the paper, from the timeline perspective, it's quite straightforward, but actually the real development is quite zigzag. So the green color, the green highlight is representing WHO. CCMD has been highlighted in yellow. CCMD in 2001, CCMD3 had deleted homosexual in its guideline. Its process is quite tricky. CCMD3 had included homosexual as the sexual orientation obstacle, but from the psychiatrist perspective, what are they trying to say is that if you are self-harmonious, if you are sexually harmonious as a homosexual people, you cannot be regarded as a homosexual people. Only you are conflicting with yourself as being a homosexual people, you can be regarded as a homosexual. So I'm sorry to be so technical. Because I know those quite common sense knowledge, you already know that. What is the self-conflicting homosexual? That means you're focusing on the sufferings. So ISCD-10 is focusing on the imbalanced sexual identity. They are focusing on the imbalanced part. What does that mean? You are homosexual, but you want to be heterosexual as SD is focusing on you are homosexual and you want to transform yourself as a heterosexual. So that gives you a kind of the sufferings. But later on, we have different guidelines that started with suffering. If you have sufferings, you can be regarded as the kind of the homosexual. So DSM is thinking if you have suffering, so that is the base for mental illnesses. This is really the this is the really a lag back thing, the backwards thing. Imbalanced sexual orientation were eventually deleted, and the sexual identity obstacle was deleted. So that kind of the removal proves that as the DSM was more advanced, even it was updated quite late, quite slowly. In 1968, in the first version, it was labeled as a homosexual as a kind of anti-human. But in some SCCMD3 carried on this legacy and still perceive homosexual as a kind of the transformed, as kind of the anti-human. So later I had a thought in Chinese. It's about to publish on medical and philosophy. If you are interested, and I invite you to have a look. And I talked about some ethical and legal issues. Last but not at least, thanks very much for your attention. Thanks, Dr. He Ying. Thanks, and we are quite expecting your publications. One is the research of your team. I think you can feel free to share with us. The other one is not to be published, and we're quite expecting that. It's quite technical. I thought I engaged with some psychological consulting people, and some of them joined in today's talk. So I think it will be quite helpful. You talked with the SMD people. I think the confirmative consultation methods you experimented and the very positive result you received will be used in various situation and in various sector. Thanks very much. Thanks for listening to us. Thanks He Ying, Tiger lawyer, Tiger, and thanks for Amika for organizing, and thanks for the platform of Hong Kong U.